Welcome to the Stop Knee Pain Now Summit. My name is Holland, founder of the Oxford Pain Clinic, and I've organised this series of interviews to bring more awareness of the range of treatments on offer to those of you who are suffering from knee pain. I have been treating old injuries for over 12 years by removing damaged tissue, finding each individual area affected so that blood and oxygen supply can be returned and the body can heal. My strengths are my anatomy and physiology knowledge and my dogged persistence. I treat individuals, I give talks, and I publish self-help guides so that people can treat their own pain. I trained because I was hit by a car, which smashed my leg. And in this session, which is my own session, I shall tell you more about that. It led me to develop this treatment of traumatic injuries for the long term. To continue the conversation on Twitter, please use the hashtag #StopKneePainSummit. And today I'm being interviewed by Jess. Hello, Jess.
Hello.
Okay, move over this way a bit. Okay. So we're both in the screen.
Okay, so Catherine, why don't you tell us a bit about your accident and how it influenced what you decided to do?
Yeah, okay. In 2000, I was hit by a car. I was just learning to ride a small motorbike, having been a cyclist all my life, and a car pulled out of a side turning and it drove straight into my leg. I didn't have time to do anything because, of course, wearing a motorcycle helmet, you don't see things approaching you until they're actually within range of your visor. So the first thing I saw was the car actually hitting me. And at that point, of course, there was nothing I could do. My leg was smashed. The tibia had a great chunk out of it. The fibula was broken in several places. But the most dangerous thing to my life was that the skin and muscles and tendons were pulled off in what's called a degloving injury, where your skin just gets pulled off the bones. And of course, this meant massive bleeding. So the greatest danger to my life was that I was bleeding very quickly in the road. And there was a point where obviously I'd lost so much blood that I began to move towards the process of dying, which is a very interesting experience in retrospect. And my curiosity really enjoyed the fact that I witnessed it and I remember it. And I was given a choice from my own subconscious, I suppose, of do you want to carry on in this place with no pain, or do you want to go back and see your children grow up? And I chose to go back and see my children grow up, which meant that I came back into the pain with a big bang. It was a huge thing. The pain was truly enormous and I couldn't tell where it was coming from. So I was parcelled up. An ambulance came, tourniquet on my leg, and I remember thinking, I didn't think they used tourniquets anymore. But of course I found out later they do. If you're about to die, they do it, because even if you're in danger of losing your leg because of the tourniquet, they think it's more important to save your life, which is fair enough. So I was taken to Holland Hospital, which is not the nearest hospital to the Solihull where I live, but it's the one with an emergency system operating at night. It was 10:30 at night when I was hit by a drunk driver coming out of the pub. And from there I had a number of large operations, including an external fixator screwed into my leg, and an orthopaedic surgeon who spent 6 hours working out what to do, screwing this big fixator in, and then he took all the broken pieces of bone that he could find out of the wound and he placed them in the gap between the two ends of the bone, with the idea that that would help my body to find the material to make the bone, and it was a brilliant thing to do. I think it was fairly experimental at the time. When I went into surgery, he told me, I'll save your leg if I can. And I said, you've got to. I'm a climber and a dancer and a cyclist, and burst into tears. So I guess he felt it was worth the effort of getting it together. And there were some amusing things that happened. Over the next 3 weeks while I was in the hospital, I kept meeting members of staff who'd been in the theatre And they would say to me, "Oh, it was you, was it? Oh, yeah, I was there. Mr. Goswami was asking us what we thought he should do, and he invited 2 other orthopaedic surgeons in, and I reckon there were about 30 people in there by the end of it. But I was so pleased. I got out, and although my leg was in bandages from the top of my thigh to my big toe, which was just peeping out about this much, my leg was still there, and I was so pleased and so grateful. Then I had more operations, soft tissue operations, the following day, I think it was, where they took a load of skin off my other leg, and I got back and I had both legs in bandages. I was not impressed, because they hadn't explained in detail what they were going to do, and of course they weren't going to take the skin from the already damaged leg. It's obvious, really, but I wasn't thinking that straight, of course not. And I was semi-conscious for about 5 days. But as far as I know, at no point did I lose consciousness, apart from when I was under anaesthetic. And they reported to me that if you lose 4 pints of blood and you become unconscious, normally you die, because you don't have enough, what I call RAM, if you're a computer person, you don't have enough energy to bring yourself up from waking. So it's quite common to die at that point. So I had those 2 points I'd passed. And when I was lying in the road, my choice had been to live. And I'd already made the choice. So I knew I was going to survive, but they didn't know that. They didn't know that I'd made that choice. And perhaps they didn't feel that it was a conscious choice, which I believe that it was. So, that's some of the difference too. And it was a long and arduous healing process. So I was there in that hospital for 3 weeks, and then I was, maybe 2, can't remember quite, but anyway, at some point I was transferred to another hospital where Mr. Sahadi, who was the soft tissue specialist who'd done the grafts, where he worked, and he had me in theatre every day to change the dressing, bandages and stuff, because he wanted it to be in as sterile environment as possible, and that's where he worked day to day. He'd only come to the other hospital to do the emergency operation. And I was there for 2 weeks, during which time I actually ventured to get out of bed. I was given a Zimmer frame and 2 nurses either side. My daughter tells me that later on that my face was the colour of the pillow slip, which was white. And yeah, it was a big journey. It was a big injury and a long recovery. I remember asking the sister in charge of the ward, how long does it take to get better from a thing like this? And she really didn't know, but what she said was more than 3 months, which was obviously her best guess. And I don't know now, if somebody told me it would take me 10 years to learn to walk again properly, I don't know how that would have affected me. But it gave me a huge insight into what it's like and how your body operates, and how incredibly good it is at healing, really good it is at healing. And I had experiences with a skin graft that took 100%, which apparently never happens. I had experiences of getting well really quickly, which was completely unexpected. And so when I started writing my autobiographical account at the beginning of this year, in February 2014, I was beginning to think, why did I survive? Why was I so good at getting well? I know I was fit, I know I was eating well, and I know that I was extreme in the fact that I only drink water, which clearly helps your blood to be clean. And I also discovered, because I started training after I was treated by a really good injury specialist who worked with her hands on me, I discovered, when I looked up in the books, why do you normally die if you lose so much blood? And the cut-off line was about 15%. If you lose more than 15% of your blood, you normally die. And I lost 50, and I didn't. And so I started asking these questions. And I started training and thinking, there's obviously something that I know and I've got and I practice that's useful. And also I was offered further surgery. So my computer's going to sleep because I'm being so boring and unanimated. And I didn't want further surgery. For me, the emergency surgery had been wonderful. I'm absolutely superb. My leg is the same length. There is no visible sign that I ever broke it, which is amazing, looking on x-rays and seeing my tibia perfectly formed all the way down as though nothing had ever happened to it. The scarring on the outside of my leg is pretty severe still, which it's too bad. I have to live with that, don't I? And I'm left with a slight stiffness in my ankle, which I'm still working on 14 years later, but it's still improving. But my idea and my wish to train was to really be able to work on deep and compound and complicated injuries where people have had high impact, where they've had extreme breakage, where layers and different types of tissue are involved, bone, ligament, tendon, muscle, and to be able to get the body in a position where it can heal from this. Obviously, when it's extreme and you've been broken that much, you have an emergency operation to begin with. But I really believed that my body was able to continue the healing, partly because I was really aware that it was me that mended my bones. There were moments when I needed to pluck up my courage. There were moments when I had to help myself to believe that everything was going to be okay. And when I went home at 5 weeks, because my daughter said she would be willing to give me 24-hour care, which I really needed. And I was very, very grateful for being able to go home because, of course, it's so much easier to sleep and get well. And I remember sitting in my bed and thinking, why are they worried about making a piece of bone that was about that big? My tibia was broken about that much. And it was missing, it was fresh air. Because I've made 3 sets of bones. I've had 3 children. You think the size of a baby, one of mine was 10 pounds. Think of all the bone in there. And I'd grown that. I'd grown it from nothing. By what I ate, by all the things you do that keep you well in pregnancy, and I'd made 3 sets. This was not going to be a problem. And I also had a real urge during that time when I was sitting on the edge of my bed to get my crutches to get out of bed, thinking, why don't I just try and stand? Why don't I just try and stand? And then after those occasions, I'd go and see Mr. Goswami and he would say, you must put some weight on this, otherwise it won't strengthen and I'll have to do a bone graft. And in my innocence, I'd just say, well, if you've got to do a bone graft, do one. But he was actually trying to get me to use my leg so that it would strengthen because he knew that was the best way of doing it. And when they did the following up x-rays, my leg was strong, the bone was perfect, and when they came to take the fixator out, which was 5 months after the accident, the screws were loose. And I knew my leg was strong by then. I knew it was all going to be okay. And I had all sorts of adventures on the way, which I won't go into now. But it was an experience that was profound and valuable because I learned so much about the way the body heals and what you need to eat and how you need to operate and the sort of exercise you need to do. Because I'm an active person. I was climbing for 2 hours and dancing for 3 hours on the night that I was hit. Because I'm a strong and active person, I needed to be able to do things, and I did. I got up and did stuff. As soon as the fixator was taken out of my leg and they put a plaster on, I was a bit disappointed because I'd hoped I'd be free. They gave me, I had the plaster, and I rang my climbing friend, and I said to him, I'm so disappointed they're giving me plaster. I thought I'd be able to come climbing. And he said, you can climb with a plaster. That's been done before. So that's what I did. And it was so lovely, that feeling of liberation. I was pathetic, of course. I'd hardly been moving. But it was psychologically, it was the thing I needed. I turned up at the climbing centre to find that there was this new route. I called it a Barbie climb. Fluorescent pink, huge holds, which I could easily climb with 2 hands and 1 leg. And so that was the beginning of my speedy and serious recovery. I was on crutches for nearly a year and I got really fed up with them. So one day I left them in the corner in the hall, went out thinking, if I fall on my face, so be it. But I never did. I just got stronger. Yeah. So that's a little bit of my story.
Yeah.
Which I've been itching to tell because everybody else has been telling theirs.
So could you tell us about how that informed your development of this old injury treatment which you give?
Yes. It was my experience that has given me not only insight, but the courage to tackle things that are compound and complicated, and also to really realise how much physical effort and pounding is necessary to get an injury that's multi-layered back to functioning. Part of this has been because I've taken it upon myself to study and understand to understand intimately the life of cells, the size of them, the number of layers that go into a normal limb, the fascia, the way that the smooth, shiny layers between muscles and between layers of the form of each of the areas of the body. If you've ever chopped up meat, particularly something like a stewing steak perhaps, you will have seen these clear, whitish clear film, shiny film, which you don't quite know what it is, and you pull it off and it's sort of springy. But within the body, that's what separates the muscles. So if one muscle's going this way and another muscle's going that way, which is usually the case, they very rarely go in the same direction. You need something so that they can glide and not get stuck. But if a car smashes through those layers, they stick together. You know, the layers grow, they're trying to mend, but some of the tissues have got in the other layers. Normally this is called adhesions and it's not too invasive. And if you treat an injury soon or as soon as you can after it's happened, while the layers are growing back, you can keep them separate by working from the outside. And even after many years after it's happened, you can separate them. It's painful because if they've grown together, when you're tearing them apart, it feels like an injury, it feels like a cut. But it works. You can separate layers out. And the other thing that really puzzles people is scar tissue. Now, I have my own theories about what creates scar tissue. Some of it's in common with other observations. But I really have this understanding that it's partly due to damage to tendons or muscle fibre or ligament fibre, where individual fibres have been pulled beyond their capacity and they've ruptured. And in that place, the damaged cells have got stuck. They've not been washed away, because if you injure your body so that you're not able to move, the speed at which the blood and lymph flows slows right down. So the damaged tissue doesn't get carried away. And what happens particularly to lymph when it's stationary is it thickens and hardens. And if you have that within the muscle and the tendon fibre, then it becomes less stretchy. It's not going to be able to either move as much or stretch as much. And you get these areas of damaged tissue, escaped lymph that hardens, and they become a lump, either a small or a large lump in the muscle. In many areas in the body this can happen. And knees are particularly prone to being fouled up by things that aren't moving properly and injury within muscles, partly because of the amount of the scope of the angle of movement within the knee joint. I have people coming to me who have knee injuries, which I treat. I have people coming to me who are lined up for a knee surgery and would rather not have it. And what I find, I also have people coming to me after knee surgery, which they have hoped will solve a problem, and it doesn't necessarily, because my experience is that the problem is usually within the tendons and the muscles linked to the knee. And although people do have successful operations to repair menisci or to repair ligaments, collateral ligaments, and that's great, they often feel that once they've recovered from those operations and things are not working as well as they'd hoped, that they need another operation. And what I would like to encourage you to do is to try to find some alternative rather than further surgery, because my experience and my belief is that things repair when oxygen and blood supply return to the area. And the more surgery you have, the more scar tissue you produce from the operations themselves, the less blood flow there is in the general area. So if somebody comes to me after one operation, I have a real chance of getting them completely better. If they come to me because they've got a chronic knee pain and they've never had an operation, the chances are I can get them 100%. The difficulties arise if people have had multiple surgery, and it makes it much harder, although I still do have a very high success rate. A lovely video testimonial from a fabulous Mauritian patient who's not that easy to understand, but his enthusiasm is huge, and it's on the YouTube under my videos, expressing his wish that everybody should know, because he'd had so many operations, he'd been to so many different styles of treatment, but to no avail until we had a really deep and prolonged effort to treat him. He came to me 3 days running, every 2 or 3 weeks, for several months, and we got him back to being able to run. And he'd been a marathon runner since he was a very small boy, and it was lovely to celebrate him being able to run again. He got injured playing football with his friends. Anyway, shucks. Okay, so what else do I want to tell you about?
Okay. So, so you obviously have a lot of experience with dealing with high levels of pain yourself, and you've experienced it through your clients as well. But what would you say causes pain?
My understanding about what causes pain, and my wish is to talk about what signals it to the body, I believe, is a reduction in blood supply and a reduction in oxygen supply. And I partly say this because I've had experience of being woken in the night by pain, and lots of my patients do too, which they find that if they move around, which obviously increases the blood flow, but you may or may not realise that when you wake, your blood pressure goes up. So when you're sleeping and resting, your blood pressure naturally goes down. But at the time that you're resting and sleeping is the time when your body goes into repair mode. So these two things may mismatch. If you have an area of injury where the blood supply is lowered because of the injury, and then overnight your blood pressure drops quite naturally because you're resting, the repair cannot successfully take place. And your body will alert to you when there is not enough oxygen circulating and the tissues are in danger of being damaged by oxygen deprivation. So this is one of the reasons why I feel that if you can increase the blood and oxygen flow to an area, it will heal. Yeah.
Excellent. That sounds very interesting. And so what treatments have patients typically undergone before they come to you?
It does vary. My favourite people to treat are those who have had big compound injuries. I get the most challenge from it. I get the most interest. I learn the most. So for me, that's why I focus on these things, because I find it really rewarding, and I'm good at it. I found something I'm really good at. It's my niche. So people come. The ones who have not had big traumatic injuries, people come, they've been to their GP, they've been on painkillers, possibly for 10 or 20 years by the time they come to me, and their motivation often is not only are they not able to function and they're hurting, but they're worried that long-term painkillers are not good for their health, which of course is a thing to be sensibly worried about. But of all of their investigation within the normal medical areas, they haven't come upon something that has helped them to get properly well. Some people have gone to chiropractors and osteopaths, which sometimes gives them a certain amount of relief. But if you understand my perspective about the increase of blood flow and how that gives the oxygen to the area that needs to repair, you will know that the standard care given by chiropractors and osteopaths doesn't have that speeding up of the blood and the flow in the body. So they may make some progress, but they don't make the sort of progress that brings them to full movement, to full activity. For those people who've been used to being very active, either because they're sports people or because they love riding their bike or motorbike, whatever it is, skiing, then they really want to get back to doing what they love, and they will keep searching. Sometimes people come saying, why wasn't I told about you? Which is such a shame. There are people available doing deep soft tissue work. I haven't come upon anybody in the same area as I'm in, much as I've looked, because of course I still want to repair my leg, and it's very difficult doing your own. But people do try many therapies. I mean, I counted. I think I've seen 41 therapists now, of all different types. I've tried all of the well-known things. I've been to private physios. I've been to NHS physios. Obviously, I had surgery. At the beginning, I had emergency surgery, but I've chosen not to have repeat surgery. Most of the stuff that has worked for me was the deep tissue work that Anne did at the beginning, because she worked on the external scars, particularly the one just above my knee, which went through the quadriceps tendon. And I believe that's what has enabled me to be able to move my leg. My knee has complete movement, which is extraordinary now, looking back and seeing what problems other people had, because I had 3 screws in a row in my tibia, just below my kneecap. And during my recovery, following the accident, that area used to occasionally itch like mad. And I realised that was the signal my body needed to try to separate some of the layers that were stuck, because I'd had screws going right through. They were about that long. They went right through all of the layers of tissue, obviously all the tendons. You probably know it's quite a busy area, and these tendons are really big, strong tendons for your quadriceps to function. So I used to rub them. When they itched, I would get my knuckles like that, and I would rub and rub until it was raw, because I knew that while it was itching, it masked the pain. And that's how determined I was to get well. And for me, as an active person, as a cyclist, as a dancer, as a climber, I was utterly determined to do all those things again, and it really motivated me. Yeah. So I tried all the different therapies as well. I've been there, I've done that, and I'm still looking.
But you mentioned that you didn't decide to have the secondary surgery that could have been offered to you as part of the recovery for your knee.
Yeah.
And a lot of your clients are as active as you are in maybe different fields, as skiing as well, maybe cycling too. Would you say that you often treat people who've had surgery already? Perhaps it was offered to them more earlier on?
I would say 50-50. I'd say half and half. So some people have had multiple surgery. Some people had immediate hospitalisation following, say, a car crash, and they were fixed at that point. And then it was only during the recovery and years down the line that they realised how hampered they were. And I think quite a lot of people are just so grateful that they've got some movement, or they're able to live and drive again or whatever, that they don't push quite as hard as they might. And then as time goes on and they feel better, because you recover slowly. It takes ages. I had no idea how long it takes to recover from an accident like that. And I remember one woman in particular came to me, and she was recommended by a chiropractor that I know who'd been treating her. She had recovered quite well, but she had limited movement and her feet hurt a lot. She'd been hit from the front in a car and it had concertinaed up, and it had broken both her legs and her feet. She'd been concertinaed with the car. And I treated her once briefly. She asked if she could come again in the same week because she was going on holiday and walking really hurt and she wanted to be able to walk and it not hurt. And she came back and was full of excitement and stood and said, "It's magic." And I treated her a couple of times. She was able to do her walking holiday. She came back after the holiday, pleased as punch, because she was able to walk without pain. And it takes a bit longer than that to make a full recovery. So she came possibly for a couple of months after that. And then she said, "I'm doing my yoga, I'm doing my Zumba, I'm doing dance." She was a drama teacher. And it was wonderful. She got back to doing 5 activities a week. And that sort of thing is quite commonplace. And it's perfectly possible for your body to recover. And what I'm doing is I'm working on layers and layers. It's quite harsh, it's quite painful, it's quite deep, because I have to work down through every layer, down to the bone, to get the blood flowing through each of those things, each of those areas. And it's hard work for me, and it's hard work for my patients. It's a real collaborative effort, and I rely on them telling me what's useful, what's a useful area, what feels right, because your body, it knows when it's being helped. And my favourite expression is, "Ouch, don't stop." And loads of people have said that. It seems to be a really common reaction of, that's the right place. It hurts. I know it's the right place because you're on the bit that doesn't have enough oxygen flowing through. You're on the part that's got the damaged tissue still in there. It needs to be brought out. It needs to be cleared out. Keep doing it because this is going to feel great. I'm going to be able to move again. And when people get off before they get off the bench, they book in the next session. And when they get off the bench, they know they can move more freely straight away. It's excellent. And part of the reason I love this is because I'm a really lazy person. I don't want to do loads of exercises. And what I found after a while, as I got better at treating people, I've been doing it 12 years now, practiced well, is that they don't need to do those exercises any more often. Quite often, if they're coming to me once a week, it just gets better. And they can do their favourite thing without needing to go through all that boring stuff.
That's what you want, isn't it? So how can people arrange a consultation with you if they've seen something which could apply to their knee pain?
Probably the easiest way to do it is to make a booking on my Oxford Pain Clinic diary online, which is oxfordpainclinic.schedulista.com, and I'll put that on the screen for you so that you can see it. Schedulista, spelt sort of the way you'd expect with SCH. By all means, feel free to phone me straight through if you'd like to. But if you do book on Schedulista, then I will phone you. So, you can do whichever you prefer.
And you talk about phoning you, so that your phone number is available on your website, I assume?
Yes, all my details are available, and they're on the website, and I'm just thinking they're contact stuff, which is all underneath these videos. Yeah.
Great, brilliant.
Yeah.
Thanks very much. Very enlightening to hear your story, and I hope it's helped some people.
Yes, so do I. Thank you. Bye-bye.